Hi, my name is Rishika, working at California Institute of Research and Technology. Today, I will be presenting a project titled Unusual Case of Embryonal Rhabdomyosarcoma, presenting as UTI. An 8-month-old female born out of non-consanguineous marriage presented with complaints of loose stools, abdominal distension, and urinary retention since 5 days, and cried during the menstruation since 4 days. On 10th day of exam admission, child developed reddish discoloration of the urine and he did not pass urine on removal of catheter. On exam, the child was conscious and coherent. On examination of abdomen, showed a dilated hypogastric area with tenderness, and on percussion, there is a suprapubic dull note, normal external genitalia, cardiovascular, respiratory, and central nervous system were all normal. So the interventions made are ultrasound abdomen, which showed adherent clot in the urinary bladder neck. And on uroscopy, it showed trabeculations and changes consistent with the cystitis. On suprapubic cystostomy, it revealed multiple clots and a mass arising from lateral wall of urinary bladder, which was removed and sent for histopathological examination. On histopathological examination, it showed sheets of round and short spindle cells, and the immunohistochemistry showed myogenin positive. So by this we can I conclude that on histopathological examination it is suggestive of malignant mesenchymal tumor, which is possibly embryonal rhabdomyosarcoma. Ceftriaxone and amikacin are given for urinary tract infection. Later the patient started on chemotherapy with vincristine and dactinomycin with cyclophosphamide. Rhabdomyosarcoma is a malignant soft tissue sarcoma that primarily occurs in the children under the age of 6 and young adults. It is uncommon in infants. Higher incidence is in male compared to the female. It accounts for approximately 40% of pediatric soft tissue sarcoma. The exact pathogenesis of rhabdomyosarcoma is unclear, but it is believed that tumor originates from the cells called rhabdomyoblasts, which are normally responsible for developing skeletal muscle. Rhabdomyosarcoma can develop almost everywhere in the body, most common being the head and neck, genitourinary tract, abdomen, and the extremities. Histopathological subtypes are embryonal, alveolar spindle cells, sclerosing type, pleomorphic. Infants younger than 1 year of age had higher rates of bladder, prostate, vagina primary tumor sites than the older children. Maternal recreational drug use, stillbirths, as well as paternal cigarette smoking, advanced maternal age, and X-ray exposure in utero, and other environmental exposures have all been linked to significantly increase the risk of rhabdomyosarcoma. The majority of rhabdomyosarcoma occurrences seem to be sporadic. However, the condition has been linked to syndromes that increase the risk of developing the cancer, like neurofibromatosis, Li-Fraumeni syndrome, Beckwith-Wiedemann syndrome. So, standard therapy is based on chemotherapy, which includes vincristine and dactinomycin with cyclophosphamide or with ifosfamide or etoposide. Other treatments are radiotherapy and surgical excision. Due in part to high rates of local failure, infants with RMS appear to have worse prognosis than older patients. Immunotherapy, molecular targeted drug therapy are novel treatment modalities now being investigated in the clinical trials. Um, Thank you, everyone. Thank you so much. I would like I would like to thank Dr. Bernie and California Institute of Research and Technology for helping me presenting this case. Thank you, Dr. Bernie.